Brooklyn Independent Television.
When women reach menopause, the so-called change of life, it can be a very complicated psychological milestone for many of them. But as Healthbeat Sherry KARABIN found out at Brooklyn Women's Services, the impact of menopause can go well beyond the emotional.
I was experiencing hot flashes and irritability, and I couldn't sleep.
50-year-old Diker Heights resident Rose LUCARELLI discusses some of the common short-term symptoms associated with menopause. Her symptoms began about 3 years ago. In her case, they became so severe that they were interfering with her quality of life.
I more or less kept track of all the hot flashes I was having in a 24-hour period, and I had 35 of them.
How are you doing, Rose?
I'm doing very well, thank you.
So Rose made an appointment at Brooklyn Women's Services in Bay Ridge, where she met with Dr. Masa Hosseini, a gynecologist and obstetrician who prescribed hormone therapy.
You're suffering from hot flashes.
Yes.
In the United States, the median age of menopause is 51. There are about 1% of women who experience menopause before age of 40, which is considered premature menopause.
What factors can influence when menopause does occur?
Smoking has been shown that can cause earlier menopause. Women who are undernourished and vegetarian has been shown to have an earlier age of menopause. Mothers and daughters tend to get a menopause at the same age.
Menopause doesn't happen overnight. It begins with perimenopause, which is when estrogen levels first begin to decrease.
Women start experiencing some menopausal symptoms, including hot flashes and changes in menstrual cycles, sometimes mood swings, irritability, and sleep disturbances.
Perimenopause can last 3 to 5 years.
After a cessation of menstruation for a complete 1 year is called postmenopause.
But the problems don't necessarily end there.
Refresh my mind. Many women experience short-term postmenopausal symptoms, including hot flashes, night sweats, which can interfere with normal sleep and increase irritability, vaginal dryness, and mood swings.
In addition to the discomfort, low estrogen levels can lead to osteoporosis or even high cholesterol. Not every woman needs treatment. Some experience mild or even no symptoms. Others find relief by using herbal remedies or making lifestyle modifications.
For example, in terms of lifestyle modifications, patients who experience hot flashes, we recommend them to dress in layers, to stay in a cool environment, avoid certain foods like spicy food or hot beverages that can increase hot flashes.
Sensitive? A little on that side.
Although acupuncture is not usually prescribed for those experiencing menopausal symptoms, it has been shown to help relieve pain and stress. So on this day, Rose paid a visit to the Green Spa and Wellness Center on 3rd Avenue to give it a try.
Okay, stay down. Okay. The acupuncture, like the whole thing, is part of Chinese medicine. It tends to balance the whole person and not just treat a specific disease. So we insert very fine, disposable, sterile needles in a specific point in the human body, and we stimulate them, and we leave them for from 10 to 30 minutes, it depending on the age, the condition, and the severity of the problem.
And I feel stimulated, like
Yeah.
inside my body.
Uh-huh.
Feels good.
Good.
Would you try it again?
Yeah, sure, why not? I would recommend it.
Still, Rose has no plans to stop her hormone replacement therapy, and in her case, she was a good candidate. Which patients do not make good candidates for hormone replacement therapy?
Women with history of breast cancer are not a candidate for hormone replacement therapy. Women who have history of blood clot, abnormal uterine bleeding, and uncontrolled hypertension. I saw you the first time, it was April of last year.
While Rose didn't have any of those risk factors, she still makes regular visits to her doctor to be sure that everything is okay, which is just what this doctor ordered.
Rose, tell me how you're feeling with the pill.
so much better. The hot flashes stopped like after a week or so. It's like my salvation.
For Healthbeat Brooklyn, I'm Sherry KARABIN.
Brooklyn Independent Television on the BCAT TV network.